Now, blows to the anterior part of the knee gets a little bit more complicated in terms of what's going to cause the injury. Like I say, if it's flexed like that, it's pretty obvious it's going to do the posterior cruciate. Okay? If you get hit right on the front like this, it's going to hyperextend, and basically it's acting like the tibia is moving anterior. So what ligament is going to go with that? Anterior cruciate. Still have posterior cruciate too. Yeah, they can. If you smack it hard enough, yeah, you can rip them both. Okay? But what happens is that if it acts like a hyperextension, it's going to move anterior like that. And let's say, for whatever reason, maybe the blow is more like this, pushes it back like that. So blows to the anterior knee could go either way. It could be anterior cruciate. Okay? And so basically when you're talking about ligament tears in the knee, or basically that's going to be a sprained knee, you're talking about some external blow like that. There's one of the ligaments that can get injured without having an actual blow to the knee. Let's see if I can. It's not showing up. Okay, watch this girl here. She's going to come up and spike it. And watch what she lands on her left knee. Doesn't look so good. Okay. So when you land on the knee like that, and it buckles or gives way like that, you're going to usually do the ACL. Okay. Most of the other times, the ligaments are going to get injured from some blow to the knee, some external impact. But if somebody lands down hard onto their knee, so they jump up in the air and they come down and land, and then, you know, if that happens like that, you saw how it sort of went in like that, and basically that's usually going to have an ACL tear. Okay, so that's the one you want to remember if it's a impact where they're landing down on the knee without any type of external blow, and then when they landed, they felt like their knee gave way. Okay? That's usually going to be an ACL. Okay? And I'll tell you another story. You ever seen that James Bond movie where he's going down the hill on skis and the guys are chasing with rifles or shooting on them? Same thing happened to me, right? Skiing down the hill, they're chasing after me with the guns. Okay, my ski goes out like that. Okay, so if my leg's moving out like this, what's going to get injured? Medial collateral, ACL, and then what else could go with it too? What's the medial collateral attached to? Meniscus. But so the history, somebody's going to say. So what really happened though was I was borrowing somebody else's skis and they were taller and weighed a little bit more, but I didn't turn the bindings down. So the binding should have released, but instead of the binding release, this released. Okay? So then I'm like moving around like this, and I feel things going on in the knee, like people will say, you know, I felt like my knee was flopping around. It was moving ways that it's not supposed to move. And I felt like bones moving against bones. And you're not supposed to feel that. Okay? And it doesn't help matters much when you know about the knee and what it's supposed to do and what it's not supposed to do. Okay? It's one thing when you see a knee getting tested from this position, okay, versus if you see it from this position, when you're looking this way, okay? And then they're going and doing the stuff like this, and then my knee's moving out like that. That's not supposed to do that. I know what they're doing, and I know that that's not supposed to look like that. But the good thing about medial collateral ligaments is that out of all the ligaments in the knee, that's the one that will tend to heal on its own. It can shorten back up a little bit, as long as you don't completely tear it. But ACLs and PCLs don't tend to heal much. Okay? And then they have this rig that they put on your knee that has a little dial that quantifies it. Basically, when you're doing a manual test, you just pull forward like that, and you compare one side to the other to see how much laxity is there. But they have this thing that gets strapped on here and there, and it has a little dial on there, and then they can measure how far it moves. And then, like when we get into the orthopedic test in ONE2, you talk about where if it moves more than, I think it's 6 or 7 millimeters. So they were able to look at it and say, well, it's not torn that much, so you don't need to have surgical repair. Okay? But obviously, you've all heard about people getting ACL repairs. Okay? Some of the Chargers had to have knee surgery. Right? So basically, the blows to the knee that come from this side usually going to blow out on the other side. Basically, whatever side he gets hit, it's going to move the other way. It's pretty straightforward when you're talking about collaterals. It gets a little more complicated when you're talking about the cruciates. But if somebody gets hit like that, you kind of want to suspect it could be an ACL, could be a PCL. If you see somebody on the table like that, and their knees has drooped down like that, what does that indicate? PCL. Because again, you always look at what happens to the tibia in relation to the femur. Okay? Anterior cruciate prevents anterior motion, posterior prevents posterior motion. Then also, you can test the knee in multi-planes. Okay? So not just straight this way, not just straight that way. So what you do is, if you externally rotate the tibia in relation to the femur, then what part of the meniscus, which meniscus did we say is going to have more strain to it when you do that? What you want to do is you think about it in terms of which side has moved more anterior. When I turn this way, medial meniscus. Okay. So then if I pull forward like this, I'm testing the anteromedial part of the joint. And then versus if I do this, I'm testing the anterolateral part of the joint. Okay. That's for if you're drawing forward. But if I'm pushing back, when I externally rotate, now this part's more posterior, so now I'm testing posteromedial and anterolateral. So it works like this.
You're testing the meniscus that way, or?
No, there's a lot of different ligaments around the knee. Okay, I only named 4 of them. There's the arcuate ligament. There's this, that, and the other parts of the joint capsule. More than what we're going to get into. Okay, but when you work this way, when you turn, let's see. So this is externally rotating the tibia. So now when I pull forward, I'm testing. Wait a minute. Medial. So if I internally rotate the tibia, then I pull out like this, I'm testing anterolateral. So if I turn like this, I'm pulling out here, I'm testing the anterolateral part of the joint. And if I push back, I'm testing the posteromedial part of the joint. So just think of it as a crisscross like that. Anterolateral goes with posteromedial, and then anteromedial goes with posterolateral. And that's when you start rotating the tibia. Okay, so that's when you get into more complicated things of multiplanar instabilities. So here's where you can injure the PCL by falling down onto the knee like that. Okay. This part's probably not. Is this in the notes or not? Okay. So again, this is stuff that you're going to do in ONE2, so you're not really going to be responsible for it. But the only reason why I'm bringing it up is because for the practical final, you just want to understand the mechanism of injury. That's why in ONE1 you're doing the biomechanics, and you want to understand the different structures of the knee so that you'll know how they can get injured. What kind of force is applied to what? Because remember, we talked about biomechanics, you're talking about forces applied to tissues. Okay? So you want to understand that these are inert tissues, so they're things that are going to get broken or torn, right? Versus you can have repetitive injuries that are going to injure tendons and things like that. But when we talk about inert tissues, it's usually going to be a traumatic injury. Okay? So you apply this force to this joint, based on what you know about the anatomy of the joint, then you're going to know, okay, you probably injured this. Okay? We talked about the shoulder. If you have an impact in this direction, and you pull back like this, what's going to happen? Yeah, so it's going to be an anterior and inferior dislocation. So you're talking about inert tissue, you're talking about joint caps, you're talking about ligaments, things like that.